Good evening and welcome to Thai PBS World Tonight. The issue of reopening the school has been debated. One of the leading virologists in Thailand has said that the issue shouldn't be made by political reason. That is the message posted on Facebook of Dr. Yong Puvarawan. In the Thai PBS World Tonight, Kun Thep Chayong and me talk to Dr. Thanarak Phalitpat, Deputy Director General of Control Disease Department, and ask him on his view on reopening school during COVID-19. So how are you? Do you feel that the burden or responsibility is a bit lighter during this second phase?
At the moment, everybody is kind of feeling relaxed and ready to go out and kind of putting themselves at some kind of risk. I believe that the level of risk is not that high at the moment, but I still hope that there will be something to remind them that this is not the time to relax everything yet.
The Education Ministry hopes to have schools reopen on the 1st of July. And of course, there has been pressure from parents and some other groups in the society for the schools to reopen even sooner. And today, there is a note of caution from Dr. Yong Puvarawan, the well-known virologist who warned that the timing of the reopening of schools should not be made as a political decision, but should be made on scientific reasoning or scientific data. So what is your view on this?
I can understand the situations because when the school is closed, there is a lot of pressure on their parents or their caregivers, and most of Thai now is both parents is working full times. If the kid is still at home, there will be problem to their parents. But the truth is there will be a risk at some level to put our children back at school in the same ways that we used to do. Because our school, most of our school, not every school, but most of our school are very crowded. In some classroom, there are more than 40, maybe 50 students in one single rooms. Those are the perfect situations for COVID spreading. The symptoms in most of the children is very mild. Because of that, any kind of screening, temperature screening, or even cough observation for cough will not help the school that much because only less than half of those children who get infected with COVID will show up with those symptoms. So at most, doing a great screening can screen only about 50-60% of infected children entering the school. That means there may be 30-40 or even 50% of COVID-infected students that can enter the school, no matter how good the school system for screening would be. So what does that mean? It means that at any time, if we are not aware, the COVID can spread in the school very easily and without anybody noticing that there is COVID outbreak in the school. I say this would be a silent outbreak. So our quick thought would be that the school may be reopened on schedule, but the ways that the school operate should not be the same. The students should sit further from each other, at least 1.5 or 6 feet or 2 meters from each other. So the school will have to find the ways to operate differently from what they used to operate. They may have to have students come in some days, not every day, probably 2 or 3 days a week. And I will suggest that students should come back into school no more than 3 days or probably 2.5 days. All the rules that apply to department store, apply to the restaurant, apply to other settings, must also apply to the school as well. The student cannot sit next to each other. They also have to wear masks at all time, and the school must have good screening system, good surveillance system, and they also have to find a ways to teach the student when they are not at school. And I think using these hybrid ideas, that is mixing between long distance and also coming to school to study, will help ease the education a little bit, and also will help ease the parents as well. So the policy of long distance learning have to go along hand in hand with the policy for work at home for both government settings and also private settings.
And so far, Dr. Thanarak, I'm sure you must be quite aware of the measure in Sweden of having no lockdown, but having the population be responsible among themselves and try to respect social distancing and wear face masks whenever they can. Do you think this practice should happen in Thailand at this very juncture? Would it be probable for people to develop immunity automatically?
The system, the healthcare system and the public health system in Sweden and in Thailand are not comparable. Sweden has a lot more doctors, a lot more hospital beds per population when comparing to Thailand. And their population density is very low. Sweden has, if I recall correctly, just around 10 million people living in Sweden. So all of this, and also they are a very well educated population. They usually follow the instruction from the public health personnel very, very well. So the health system is not comparable. They are developed countries with a lot of resources. The population is different, and the ways they react to the situation is also very different. I still believe that we have to be very cautious at all time. When we compare ourselves and very well developed countries, I don't think the situation in the countries can compare with us. For example, if we have, let me give the numbers. For example, if we have about 100 cases per day, very soon our hospital may be jam-packed with all the patients. But in Sweden, I think they are still fine for them because they have so many resources, many hospital beds for all the patients that they may have. So that is why we have to be very cautious at all time, because in the past we did not invest in the healthcare system that much. We have lower number of doctor per population. We have lower number of hospital bed per population when compared to most of the developed countries. So that is why we have to do what we have to do today.
And that's all from Thai PBS World tonight. Thank you for watching.